The coronavirus vaccine still continues to roll out across Illinois, and as of this past Monday, 1 in 8 people in the state had received a vaccine. But there is plenty of work that needs to be done to get more vaccines and then to get people vaccinated. Joining me now is Dr. Atul Gupta, infectious disease expert at Silver Cross Hospital in New Lenox. So nice to see you. Thank you for taking the time this morning.
Good morning.
So how has vaccine distribution been going at your hospital?
We've been doing a great job. I'm really proud of the work Silver Cross Hospital's been doing. Our initial mandate was really just to vaccinate our own staff, but our hospital leadership really said, we need to serve the community. And we're very proud to be working with Will County Health Department to provide vaccines to vast numbers of people in the community. We've done 4,000 teachers. We're reaching out to people 65 and above to really get the highest risk populations vaccinated first. We're partnering with local churches and other community groups to get minority populations involved, and we've given 12,000 vaccines total so far.
That's awesome. Congratulations. What about the shortages that we keep on hearing about of the vaccines, and then with the weather that just happened, making that even more complicated? Have you experienced that?
I know it's been very frustrating statewide with the relative lack of vaccines. We're obviously excited so many people want the vaccine. At our hospital, we haven't had that problem. Our pharmacy manager had the foresight to get an ultra cold freezer early on, and so we've been able to get Pfizer vaccine that a lot of other people haven't been able to take, which is also part of the reason we felt a responsibility to give the vaccine to so many people.
And I know that we're headed to this next phase. We're in 1B right now, and then we move to people with these underlying conditions. That's happening tomorrow. Are you actively going out and pursuing that group of people? Do you have enough vaccines for that next phase rollout?
Right now we're really focusing on the highest risk elderly population. We're constantly revising our vaccine distribution plan. And we will likely at some point be including those people, but really right now, we know that the highest risk for serious complications is in the elderly population and healthcare workers. We really want to focus on those right now.
And I know earlier you mentioned minority populations. That seems to be a place where there's a lot of mistrust with the medical community. Are you finding that, and how do you combat that?
We have had that issue even amongst our own hospital staff. We've been having meetings and educational opportunities with our staff to really get them to understand the safety and the importance of the vaccine. And in the community, we're partnering with community groups that are trusted by certain ethnic minority groups, as you mentioned, who are skeptical naturally of certain medical advancements, and really trying to bring them in and have them understand, because unfortunately, they're also higher risk for having bad outcomes from COVID.
And my last question to you is this information overload that we have. There was an article in the New York Times about, the fact that there are all these variants that are coming out, and some people are just saying, I am not going to get the vaccine because maybe it's not as effective with the other variant. Maybe now I'm going to need a booster, so I just don't want to have anything to do with the vaccine.
Unfortunately, in the medical and scientific communities, we really, we want everything to be as effective as possible. So we tend to focus on all the possibilities that might make something less effective, without, really fully explaining. Right now there are variants circulating, but the data we have shows the vaccines we have should still be effective against those variants. So it's really on us to educate the public better, so that they do trust that these vaccines are safe, effective, worth getting. Really, instead of people looking at these vaccines with fear and mistrust, I want them to see them as a source of hope and optimism, because they really are our ticket out of this.
Well, I have to tell you, Dr. Gupta, you are a voice of calm and reason, which is really great. As a spokesperson for that hospital, we sincerely appreciate your time. Medical Director of Infection Prevention at Silver Cross Hospital in New Lenox. Good luck to you.
Thank you very much.